So whenever we are looking into designing clinical studies, you need to have a goal. And of course, we're looking into some benefits for patients, but we're also looking into benefits for clinicians. So the ultimate goal when you do think about implant dentistry is obviously trying to change clinical concepts that might be easier and more applicable for general clinicians placing dental implants, but also might be beneficial for patients. And that was initially the idea of starting this multi-center study comparing short dental implants versus longer ones combined with sinus grafting. When we look at the key findings of this specific multi-center study, we're looking at some key findings on the short run. Short run actually means within the first 6 months. So key outcomes certainly we're comparing the impact of the surgical procedures on patients' quality of life. And clearly we did see some benefits associated with shorter dental implants. We had much less overall morbidity within the first week after surgery. And that's obvious because we kind of avoided having a more extensive surgical procedure such as sinus grafting. And when you look on the long run, at the end, you're basically comparing two concepts. And we currently have 10-year data that will soon be published. And very much like the data because the data basically tell you for all the outcome measures, including the most important one like survival, looking at marginal bone loss, peri-implant health, that there is no difference on the long run between these two clinical concepts. As a clinician, you can still choose. You can either still go for the more complex procedure of a sinus grafting and longer implants, or you can just completely avoid it and just place shorter dental implants.